98% of headaches are primary headaches, and then the remaining 2% are your secondary headaches. We're going to start by talking about IIH, idiopathic intracranial hypertension. The old term for this disorder used to be called pseudotumor cerebri, because essentially it mimics having a brain tumor, except that there's no tumor. And the idea behind it is the pressure inside the brain is elevated. So that's what we call the intracranial pressure, the ICP. So if this is the brain, you have fluid-filled cavities. These are what we call the ventricles. And then you have fluid also around the brain underneath the envelope, the dura. And the idea behind this condition, IIH, is essentially that the pressure inside the brain is building up. That tends to be seen most commonly in women, specifically in obese women. So those are the top 2 risk factors for this condition. And the third risk factor for the condition is also specific medications that can put you at risk for IIH. But the bottom line is that you have an increase in the pressure inside the brain. And when that pressure inside the brain increases, it leads to a constellation of headaches. And that leads to blurry vision and what we call papilledema, which is essentially swelling of the optic disc that can be seen on an eye exam. And then it often also leads to whooshing sounds or some kind of intracranial noise. So it can be whooshing, it could be clicking, it could be ringing. So that's a common feature of those headaches. And another important thing is that they tend to be positional. So they get worse if you're lying on your back, and especially in the morning, and because that essentially leads to an increase in the pressure because of gravity. Now, how do we diagnose these conditions? So MRI tends to be very useful. First, because we want to make sure that there's no actual mass or tumor. And then 2, we get to see sometimes evidence on the MRI that indirectly suggests that this is the condition that the patient has. So things like an empty sella, which essentially means that this part of the brain, which is almost like a collapsible vein, when the pressure is elevated, this one will collapse, and then on an MRI it looks empty. And so we call that the empty sella sign, and that a lot of times is associated with this condition. However, the gold standard to diagnose it is a lumbar puncture or a spinal tap, where basically we measure the pressure, and if that pressure is above, let's say, 25 centimeters of water, then in that case, that diagnoses the condition. Like I alluded to before, this condition involves the eyes and the optic nerves. So very commonly, we will actually send the patient to see ophthalmology or the eye doctors to make sure that there's no swelling of that optic disc, because the most serious complication of the condition is essentially losing vision because of that buildup of pressure in the optic nerve. Treatment for this condition starts with more conservative measures like weight loss. But then if that doesn't work, we start medications that lower pressure. So that will include Diamox. The generic for it is acetazolamide. It's a water pill, a diuretic. But sometimes we use Topamax, topiramate, which also has a similar mechanism. We call a carbonic anhydrase inhibitor mechanism. So those are pretty much the 2 main medications that we use for the condition. If medications fail, sometimes we have to do several lumbar punctures to get rid of the fluid. And the last resort is surgery. That surgery can either be a shunt, like a VP shunt, a lumbar drain, it could be fenestration on the optic nerve, or it could be stenting in the venous sinuses. So there's more than one way, and a very thorough conversation is usually had with the patient if the time comes for surgery, for more invasive therapy.